Dr. Garda here with part 1 of our 5-part series on sciatica. Okay, so at least 80% of all Americans are going to experience lower back pain at some point in their life, but with sciatica, something is completely different, right? So the pain can start in your lower back and then it goes into your glutes, and then it can shoot down into your leg to the knee, and sometimes it can go past the knee into your foot. Now that shooting pain into your lower extremity is caused by a compression of the nerves that are exiting your spine. So even a small amount of pressure can cause a tremendous amount of pain. So getting rid of the inflammation and opening up that nerve hole is essential to find relief. The reason that sciatica is so painful is that it takes very little pressure to start to damage that nerve. So Dr. Chung Ha Suh, out of the University of Colorado, he did a series of studies, and what they found is that as little as 10 millimeters of pressure, that's about the same weight as a dime on a nerve, can cause up to 60% of a decrease in that nerve's function. So this is a very good reason that our brain is encased in bone and our spinal cord is encased in bone. We're created so that our toughest material protects our most sensitive material, our brain and our spinal cord and our nerves. So when that sensitive material gets squashed down, that in that sciatic nerve, if it gets a little pressure on it, it can cause a tremendous life-altering pain. The way that your sciatic nerve gets pinched or compressed is usually because of an injury. It can be all at once or gradually over time, injury of your disc. So when you have a bulging or herniated disc, the nerve that is exiting your spine is now affected. As we said earlier, it only takes a little pressure on that nerve to cause a tremendous amount of pain in your leg. So that's the bad news. The good news is that there is a ton of research out there that has shown that people struggling with sciatica can get fantastic results with chiropractic. Our goal is we want to find the exact cause of your sciatica, and we want to determine with that the best course of action for you. So now forming a good diagnosis involves a good consult, proper physical exam, and also usually will include x-rays if it's medically necessary, so we can see in black and white exactly what is happening with you. We want to make sure that you're in the right place and make sure that we can help you, and to see if there's any contraindications to chiropractic care. And by the way, there's some research out there that showed that chiropractic care was 60% successful with people with sciatica, the same degree as people who underwent surgery. So that's all the benefit as the surgery, but without the risks of surgery. So that's pretty cool. Okay, we made it. Dr. Garda here with part 5 of 5 in our series on sciatica. Okay, so in the office, we use different kinds of techniques. We want to open up any restricted movement in your spine. In order to realign your spine, we have different techniques. We want to get proper alignment in your spinal column. Okay, so now spinal adjustments, what they do when we have proper movement, we reduce inflammation on the nerves. We reduce muscle spasms. We reduce that pain associated with sciatica. And also important, your adjustments should feel good while they're happening, right? So healing should feel good. Does that make sense? And even better, chiropractic spinal adjustments have been proven safe and effective. In college, we learned all kinds of different techniques to help address all kinds of different problems in your spine. So if you or someone you care about needs help, please feel free to reach out, and we'll find out what's going on and see if we can help you, get you on the road to relief. Okay, thanks guys.